Okay guys, we will talk about the muscarinic receptors. Muscarinic receptors, you should remember these all receptors are G protein coupled receptors M1, M2, M3, M4 and M5. M1 is GQ coupled, M2 is GI coupled, M3 is also GQ coupled, M4 is GI coupled and M5 is also the GQ coupled receptor as well. Okay, you remember that what is the GQ coupled receptor? That GQ coupled receptor, there is increased IP3 and DAG cascade, and in GI there is decreased cyclic AMP production as well, and in case of GS there is increased cyclic AMP production. Okay, now what is happening in cases of M1 receptors? M1 receptors is mainly located in the CNS and it causes excitation, and in the gastric glands it causes increased acid secretion. The M2 receptors are mainly located in the heart. First thing that they do via the SA node, they decrease the heart rate. It means that they have negative chromotropic effect, and at the AV node, they decrease the conduction. It means they have the negative dromotropic effect. They don't have the negative inotropic effect as well. Okay, in case of M3, we will learn it in a sequence that what is going to happen. First of all, in case of M3 receptor, it will act on like ice. In eyes, it causes meiosis via the contraction of the ciliary muscles and the sphincter muscles of the iris. In bronchioles, it also causes contraction and causes the bronchospasm. In vascular smooth muscle cells, it causes vasodilation, but not directly via the release of NO. It causes the vasodilation. In the GIT, it increases the motility. That is what we also call as the peristalsis, and results in diarrhea. And in case of sphincters in the GIT, it relaxes all the sphincters except lower gastroesophageal sphincter. And the urinary bladder, what does it do in the urinary bladder? It increases the contraction of detrusor muscle. It means it causes urination. And what does it do in the glands? That are the exocrine glands. It increases salivation, lacrimation, sweating, and bronchial secretions as well. M4 and M5 are mainly located in the CNS, and they also causes CNS excitation. Now we will talk about the alpha and the beta receptors. First of all, the alpha receptors. Alpha, beta, and dopaminic receptors are the parts of the sympathetic nervous system receptors. The alpha 1 receptor is GQ coupled. The alpha 2 is GI coupled. The all beta receptors are GS coupled. D1 is GS coupled, whereas dopaminic 2 receptor is GI coupled. Okay, now where they are acting and what are their functions as well. The alpha 1, first of all, if it acts on the pupillary dilator muscles, it contracts them and thus causes mydriasis. In the vascular smooth muscles, it causes contracts them and causes vasoconstriction, thus helps in increasing the blood pressure. In the pilomotor smooth muscles of the skin, it contracts them and thus erects the skin. Next, and it increases the contraction of the bladder trigone and also of the prostatic smooth muscle. Therefore, it is contraindicated in the patients with the benign prostatic hyperplasia. And in liver, it increases the glycogenolysis. It means the breakdown of the glycogen. Now, the alpha 2 receptor is GI coupled and its functions. First of all, it inhibits the neurotransmitter release in both adrenergic as well as the cholinergic nerve terminal. It is also the alpha 2 receptor acting drugs are also called as the sympathogetics as well. Next, it causes platelets aggregation. Then it also causes vasoconstriction. It inhibits the lipolysis in the fat cells, and it also inhibits insulin release from the pancreatic beta cells as well. Okay, now dopaminic. The D1 has dose dependent effects. It is one of the most important questions asked by the examiners. The dose dependent effects of the dopamine. First of all, at low doses, at moderate doses, and at high doses. At low doses, it acts on the dopaminic 1 receptor and it relaxes renal and splanchnic vasculature. At moderate doses, it acts as beta 1, increases the contractility of the heart and thus increases the cardiac output as well. And at high doses, it acts as the alpha 1 and it increases the blood pressure via vasoconstriction. The dopaminic 2 is GI coupled. It means it has inhibitory action and its main site of action is nerve terminals. Assalamu alaikum. We're going to talk about the beta receptors. There are 3 beta receptors, beta 1, beta 2 and beta 3. 3 of these receptors are GS coupled and they are more sensitive than the alpha receptors. Now I will talk about their site of action and their function. The beta 1 first of all acts on heart. Most importantly, it increases the rate and force. Similarly, it also acts on the juxtaglomerular apparatus of the kidney and it causes increase in the renin release. Beta 2 relaxes the vascular smooth muscles and causes vasodilation. Similarly, it causes bronchodilation and it also relaxes uterine smooth muscles. And the pancreatic beta cells, it increases the insulin release. In the liver, it stimulates glycogenolysis, that is the breakdown of the glycogen. It has some effect on the heart as well, and in the somatic motor neurons, that are the voluntary muscles, it causes tremors. Okay, the beta 3 has main action on the adipocytes and it stimulates the lipolysis. One of the most important questions that are being asked by the examiners about beta 2 is that norepinephrine do not act on beta 2 receptors. Why? Because these receptors are not innervated. Due to which the norepinephrine will never reach there while epinephrine can reach, and when norepinephrine will never reach, it cannot act on these beta 2 receptors.